Thanks for joining us for K2W Q&A. This entire half hour, we're focused on answering your questions about the coronavirus pandemic. All right, let's start tonight with something everyone has a lot of questions about: money, and especially those stimulus checks from the federal government. We're going to bring in April Gutierrez with Pacific Northwest Tax Service as our live guest tonight. And April, what kinds of questions or problems have your clients had with the stimulus check?
First off, the phone calls have started coming in as soon as it was announced there would be a stimulus check, and everyone was wanting to know, when am I going to get it? How much am I going to get? By this point in time, a lot of people have gotten them. There's family members I have who've received them. And now questions that I'm getting are, why haven't I got my stimulus payment yet? And I actually did get a call this week from a client who used direct debit to pay what they owed to the IRS. And one would have thought that the IRS would use that information to then deposit the refund. If the money could come out of the account, then surely they could figure out to put it in. But that isn't actually what happened with him. He ended up getting his check in the mail, and that was a surprise to him. So if you haven't received your stimulus check yet, or you haven't received a deposit into your bank account, you could be using the IRS's website to figure out where your payment might be.
Right, yeah, so if people have not received that check yet, what is your best advice for them?
Well, the best advice, if you haven't gotten your payment yet, is to go to the irs.gov website, and there is a link on the website that you can click, and then you would enter your social security number, your date of birth, and your address, and then the government will use that information to tell you what the status of your stimulus payment is. And it may be that you've already received it as a direct deposit into your bank account, and you don't even know it's there. So do go look. Today, when I did it for a family member, it shows that her stimulus payment is going to go out on May 1st.
Okay.
So I'll be able to give her that happy news.
Okay, good. So let's talk about taxes. What should we factor into filing our taxes during the extended 2020 filing season, for the 2019 tax returns?
Well, this is a kicker year for Oregon. So people who are filing their tax returns for 2019, we're seeing quite a few people with pretty big refunds, much, much larger than is normal for Oregon, because 2018 triggered a kicker as a part of the 2019 tax return. So lots of folks are a little bit nervous about filing, and they're holding off on filing because they're worried that they owe the federal and they don't have the money. Well, you really don't have to pay what you owe to the IRS until July 15. You can file your tax return today and not pay until July 15. But if you file your return today and you have an Oregon refund, then that will speed up receipt of the refund. So holding off filing because you owe the IRS doesn't really actually make a whole lot of sense when you realize the time or the date that you pay doesn't change regardless of when you file. There is also an interesting twist that's come up. I've had a few clients that their income in 2019 is higher than it was in 2018. And so they've said to me, well, I don't want to file 2019 yet, because if I file 2019, I won't get a stimulus payment because my income will be too high. But based on 2018, my income is low enough, so I don't want to file now. I'm going to wait until I get my stimulus payment, and then I'm going to file. And then you've got that other section of people who maybe their income is too high in both 18 and 19. What's going to happen to them? And the answer is, well, when they get to 2020 and it's time to file their 2020 return, and actually that'll be in 2021 that we're filing our 2020 returns, at that point, if the income has dropped low enough, it could be that you would be able to receive your stimulus payment as a part of the filing of your 2020 return, because in fact, the payment is a part of the 2020 return.
Okay, that's good advice. And what about small businesses? We've heard of so many small business owners having trouble with the Paycheck Protection Program. I mean, do you have any advice for them?
My advice for it is, if you haven't already applied, to do so now. If you go to the SBA website, they do have a link on there where you can look for local lenders in your area. And one of the things that has been a problem is the really big banks have monopolized a lot of the money, but the second passage of stimulus money that came into law just over the weekend allots a certain amount of extra funds for small local community banks. And so if you're finding you're not making any headway with a larger bank that you might already have a relationship with, I would encourage you to try with the local banks. But there is a limited amount of money there, and I am concerned I am concerned that we're just going to run out. Now, I can say that as soon as the stimulus package became law, I mean, I was grilled into that as a tax professional for my small business clients. I spent 2 days reading it, reading the code, the new code, and doing some illustrations to figure out some scenarios for my tax clients of what they could expect to receive if they applied for a loan. And I provided my clients with that information within 2 days of the passage of the law. And so we had a lot of clients who applied because we told them to. Roughly half of them told us they got their funding with the first go round, and the remainder are telling us that they are getting funded on the second go round. But this is a really unscientific measurement. It's just what we've gotten from talking to some of our clients.
And I wanted to ask one viewer question. A viewer reached out to us and said, I just got my $1,200 stimulus check, and I'm trying to understand if this is a tax credit, a loan on my tax refund for 2020, or just $1,200 free cash. You know, can you help clear that up?
It's $1,200 free cash, but it is associated with your 2020 return. So what that means is that if you don't get the stimulus payment now, when you file your 2020 return, you may have a second grab at it. But anyone who receives a stimulus payment because their filed tax return for 2018 or 2019, whichever one it is based on, finds that they're getting it because their income was low enough, and then their income rises in 2020, they're not going to be required to repay it.
Okay, interesting. Thank you so much for your time and for all of this great information.
Thank you.
Many parts of Oregon and Southwest Washington are getting antsy about opening up again. So what are those areas doing to try to make sure it's safe to do so? Pat Doris has the answer.
Rural counties all across Oregon are trying to figure out how they can open their economies again, and especially those that have zero or very few coronavirus cases are working hard because the governor has said they'll be at the front of the line. So they're going through and they're trying to make sure that they have enough protective gear, that they have enough testing, that they have enough contact tracing, and that they have a way to isolate people who do get sick so that it doesn't spread to the rest of the population. They're compiling reports on that, sending it to the governor's office and starting discussions. Some of them think they might be able to open in as little as 3 weeks, others 4 weeks, but it's definitely something that's coming.
All right, thanks, Pat. Take a look at this map here. Now, these red states, these 14 states, are where governors have started to lift restrictions and reopen some places like malls, even movie theaters. I asked Dr. Joseph Fair, could we see a spike in COVID-19 cases across the country as things start opening back up?
Well, we'll know in a couple of weeks, but, you know, I think we're going to see at least a minor spike. We are entering the summer months, especially in those areas of the country, Texas and Florida. And so if we go back and talk about a dip that we normally would see with cold and flu viruses, and all of the science that was presented by the White House this week indicates that, you know, COVID-19, the virus that causes it, will behave similarly in the summer. We should see less cases in those summer, you know, hot and humid months, and we should see just kind of that natural dip, and then we'll probably see a resurgence in the fall. But I do expect, for at least temporarily, once these measures are relaxed, that you'll see a spike in cases, and you know, it may continue well into the summer. This is a new virus to humans, so we still don't know exactly how it's going to behave, so we're making a lot of assumptions.
You've probably been hearing about different tests for COVID-19, so what's the difference between antibody tests and ones that just test for the virus? We'll have the answer next. But first, here's a quick Q&A. What are the new symptoms of COVID-19 just added by the CDC? The answer, there are 6 new symptoms: chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. That's on top of cough, fever, and shortness of breath.
The World Health Organization is warning that even if you recover from this coronavirus, you may not be immune. So what does that mean for people desperate to go back to normal? Let's connect the dots. One key to communities opening back up is herd immunity. That's the idea that a high enough percentage of people are immune to a contagious disease to stop it spreading through the population. But not all immunity is created equal. For some diseases, like mumps, once you've had it, you are immune for life. But for others, like the common cold, it's a few months. Antibody tests will show if your immune system system has fought the coronavirus, but they can't reveal if you are now immune to it. This virus is just too new to answer that question. And finding answers is hard. The first way is to try and infect a virus survivor again, which obviously raises moral questions. The other is to measure antibody levels over months and years to see if they begin to lower, and that obviously takes time. A reminder that there aren't a lot of easy answers in this fight. Connecting the dots, I'm Marcelino Benito.
Now, some people hope antibody tests could help us reopen the economy faster, and those could help determine who has already had COVID-19. So what's the difference between an antibody test and a test for the virus itself? Our Verify team is here to break it down.
There are a lot of tests for the coronavirus. The FDA has a list of 50 approved and about 115 more that are being reviewed, and they use a lot of different methods to get a test sample. There are nose swabs, finger pricks, blood samples, and more. So what's the difference with these tests? We brought in Dr. Michael Borowitz, the Executive Deputy Director of Johns Hopkins and the Laboratory Director of Johns Hopkins Hospital.
There's really two fundamentally different kinds of tests that tell you different things.
The first is the molecular test, or what most people think of as a COVID test. Most commonly, they use a nasal swab deep in your sinuses to get a sample. The sample is then tested for the actual virus itself.
Molecular tests, the tests that actually look for the RNA of the virus, are analytically very accurate.
The benefits of this test? According to Dr. Borowitz, it's the only definitive way of knowing if someone currently has the virus and whether they're contagious. The negative, it's a little slower, typically taking about a day for results. The second type of test is the antibody test. It's a quick turnaround test, results in minutes. Instead of testing for the virus itself, these tests look for antibodies your body made fighting the virus and the potential for plasma development used in treating the symptoms of COVID-19. But it has its limitations too.
It doesn't tell you just because a patient has an antibody that he's necessarily immune to the disease. That's what everybody wants to know, but that hasn't been proven.
And it can't tell you whether you're actually over the virus.
You don't know for sure when you have somebody who has antibodies is whether or not they're still infectious. So if they've had the disease and they've developed antibodies, they may or may not still be infectious.
So basically, the molecular COVID tests tell you if you have the virus. The antibody tests tell you if you've had it. And Dr. Borowitz believes as antibody testing continues to develop, there's potential they can do more.
If we ever get to the point where the results of those tests are not only telling you exposure, but also telling you immune status, then they become extremely important, because then at that point, you can start using them for making decisions about how you manage people.
If you've got any other questions for us to look into, send us an email. With your Verify, I'm Jason Puckett.
Researchers are doing lots of clinical drug trials right now. So do any offer hope for a COVID-19 treatment? That's coming up. But first, here's another quick Q&A. When will widespread antibody tests be available? The answer likely sometime this summer. Some rapid response blood tests have already been developed, but they haven't been distributed throughout the country yet. And welcome back. A lot of people have questions about possible treatments for COVID-19, and right now researchers are working on clinical trials. I asked Dr. John Torres, what did a study involving an arthritis drug find, and what are we learning from all these trials?
And this medicine in particular is called Kevzara. It's a medicine that's been used for arthritis for a while, and the hope was, since it handles inflammation, that it could handle something called a cytokine storm, which is basically the immune system kind of going into overdrive, trying to fight the coronavirus and hurting the patient themselves. It turned out not to work very well, at least in most cases. In the critical cases, it seemed to help a little bit, and we're finding it out with other medicines too, like hydroxychloroquine. The bottom line here is it takes time to study these medicines. That's the way biology works. You really can't rush that. So until we get definitive answers, or at least as definitive as we can, we need to be a little careful and cautious with how we apply these. And so people shouldn't be taking them on their own. They shouldn't really be asking their doctor for them at this point. We should let science do what it needs to do to find out if these things are going to hurt us or these things are going to help us. We want that answer.
And you heard Dr. Torres mention hydroxychloroquine. That's a drug that President Trump has talked about as a possible treatment, but the FDA has cautioned against using it due to a possible heart rhythm problem. I asked Dr. Kavita Patel, are hydroxychloroquine trials still happening, and could it be a worthwhile treatment?
There are still ongoing trials, but We actually have already had one trial in Brazil stopped for patients with severe COVID who were on chloroquine and azithromycin, an antibiotic, because there was a higher death rate. So, Kristen, that's pretty serious outcomes. But the kind of bottom line for any viewer is that you should not be asking for these drugs unless you are in a trial under the care of a physician or a team in a hospital setting. So even the trials that we do have that are ongoing are giving us some alarming results that are causing all of us to pause on whether this should be a treatment for COVID-19.
Meat processing plants are shutting down due to the pandemic. So how is that impacting our food supply? We'll have the answer next. And welcome back. Oregon's cattle industry is a big part of our economy, but right now it's feeling the effects of the COVID-19 pandemic. Processing plants are running at a limited capacity or have been shut down. So what does this mean for you and me? Lindsay Nadrich explains.
Oregon's cattle industry contributes hundreds of millions of dollars to our state's economy. But the industry has been hit hard by the COVID-19 pandemic. A study released this month estimates it will cost the cattle industry $13.6 billion. Here's what's going on in a nutshell. Ranchers have cattle they sell to processing plants, but the plants are running at limited capacity or closing completely as workers test positive for COVID-19. So there's more cattle out there than these processing plants can handle, which means ranchers aren't making as much money on their cattle. But it also means there's now a limited supply of beef, which makes it more expensive for you and me at the grocery store. I'm Lindsay Nadrich, KGW News.
And with restaurants closed, a lot of us are digging into our own pantries for dinner these days. And a lot of people are trying to save money, so you might not want to throw out food as quickly as you used to. So if you have food that's past its best by label date, is it still safe to eat? Evan Kosloff has the answer.
Our experts say that in general, most food date labels tell you when the food is at peak quality, not whether they're safe. Take these 3 labels on items I grabbed from the fridge. Best if used by is about a product's best flavor or quality. Used by, that's the last date recommended for peak quality. And sell by tells the store how long to keep an item on the shelf. The USDA says none of those labels tell you about a product's safety, with one exception: baby formula. One of our experts, Abby Snyder, says the shelf life of food really depends on what you're eating.
So shelf-stable foods in your pantry, like canned foods or dry goods, are safe to eat after their best before date listed. Fresh cut produce like melons, soft cheeses, lunch meat, they often bear that use by date that should be followed.
As for how long food will stay good after those label dates, the USDA says that depends on the type of food and how it's stored. Things like temperature and moisture. They say the best advice is the simple advice. If it smells bad or if it has a weird texture or flavor, just throw it out.
And thank you for joining us tonight. KGW is committed to continuing coverage on the coronavirus outbreak. If you still have questions, our past stories may answer them for you. You can go straight to kgw.com/answers to see all of our past Q&As and all of our past stories. We'll see you back here tomorrow at 7 o'clock for KGW Q&A.